Hello everyone, hope you all are doing really well, and the purpose of this video is to talk to you about your clinical exam for the Diagnostic Audiology module. Now, as you know that we will not be having a face-to-face exam in the university due to COVID-19 and the restrictions which it has caused as a result of it. Now, this exam will be online. Okay, and I thought I'll take you through series of things which will be involved in this particular exam. You all will be booked in for a slot between 45 minutes to an hour's time. You all will be giving this exam to one examiner online. Okay, so there'll be just one person who will be asking you series of questions, clinically relevant series of questions. Now, most of these questions are, as I said, are clinically focused. Okay, so it'll be important for you to revise few things which you've done really well in the past. For example, what are the health and safety considerations you need to keep in mind before you start a hearing assessment? Then when it comes to doing otoscopy, in a live exam, we could actually see you how you'll be doing an otoscopy, okay? However, in an online Viva, we'll ask you how exactly will you do otoscopy? What are the various points you need to keep in mind? For example, what should be your position, how you should be holding the otoscope, how you should be holding the person's ear, etc., etc. Okay? So it'll be important for you to keep those things in mind, and you should be able to explain those things really well to the examiner. Then moving on to the next question, where you'll be asked to give instructions. For example, if you were to give instructions for hearing assessment, for measuring uncomfortable loudness level, for masking, for tympanometry, what exactly will be your instruction? So step-by-step guidelines of those instructions, you'll be expected to share those with your examiner. You'll be expected to talk to them as if you have a client in front of you. So how exactly you'll be talking to your client is what you should be talking to your examiner as well. Then moving forward, you'll be asked types and degrees of hearing loss based on an audiogram. So for example, if an audiogram is shared with you and then the examiner asks you, okay, based on these right and left ear responses which are plotted on the audiogram, what exactly is the type and degree of hearing loss? Okay, so you should be able to interpret that audiogram and you should be able to explain this to the examiner, that what is the type and degree of hearing loss. Moving forward, you will be given a printout of an tympanogram and you'll be asked a few questions about it. For example, based on looking at a tympanogram, if someone is asking you, so what type of tympanogram is it based on the Jurgens classification? You should be able to look at the values and be able to interpret those values and say confidently, well, this is type A, type AS, type B, type C, and why this is type A or type B or type C or type AS. Okay, so you should be able to also read some of those values from the printout. For example, what exactly is the ear canal volume mentioned in this particular result printout, and what is the compliance value? You should be able to say those values as well. Then moving on to the next question, where you will also be given a printout of acoustic reflex thresholds plotted, and then you'll be asked questions such as, so is it for right ear or left ear? And all of those answers will actually be there on that print in front of you. It'll be just a matter of you being able to look at those values and interpret it. Okay, so for example, when you do these tests, you do start from certain intensity, then you check the response, then you move further and then move further. You'll have all those responses plotted in the printout, and then you'll be able to look at it and should be able to answer that, okay, this particular printout, this right ear is being tested at this particular frequency, the test is being conducted, and based on these results, the threshold, acoustic reflex threshold of the person is this. Okay, so I think in a sense, all of these things have been covered really well in your class, in the lectures, as well as your time during your clinical skills lab. Unfortunately, we will not be able to assess how well you are able to conduct these tests because of obvious limitations. However, we would still like to assess your clinical capabilities in terms of interpreting the results based on an audiogram or tympanogram or acoustic reflex, and also your clinical competencies in terms of how you'll be giving instructions to your clients, health and safety requirements you need to keep in mind, how exactly you'll be doing otoscopies and things like that. Okay, so this will be the overall structure of your clinical exam. Now, coming to 4 most important tips you need to keep in mind when you're gearing up for this online Viva exam. First and most importantly, make sure your devices are fully charged or you have a charger nearby you, okay? Because the test will last roughly for 45 minutes to an hour's time. So make sure your devices are fully charged or you have a charger next to you. Second, make sure you're well rested and you are dressed professionally. So they call it power dressing. You dress well, you feel well, you project the confidence, okay? So dress as if you are going for a live face-to-face exam. Third and most important tip, during these online exams, in case if you require any clarification, you're not sure of what is asked, feel free to ask for repetition or clarification, okay? And most important thing, use this exam as an opportunity. As you know, with COVID-19 and this pandemic, everything is changed, and even the future of audiology is going to be affected by it. So the new norms might be very different, and it's very likely that a lot of you might have to do a lot of online work going forward in the next few years, okay? So use this as a brilliant opportunity to experience this and enjoy that. That's the most important thing, okay? And based on what I know of all of you, I know for sure that you will do a brilliant job. Another thing, you will probably not see me during these exams, and you all know the reason why, right? So I'll be away for the personal reason which you all know, but I would also like to wish you all the very best. I know for sure that you all will do really well. Make sure you're relaxed, make sure you have done your revision, you have practiced your things, and trying to be as mindful as you can during that exam so you all can do really well, okay? Any questions, do not hesitate to flick me an email. All the very best. Take care. Bye.